Healthy Every Day, helping make a difference for life.
Hi, everyone. For Healthy Every Day, we're here at Nebraska Orthopaedic Center. I'm joined by Dr. Freeman. We're talking all things injury-related to our shoulder and our elbow. This is something certainly that you understand because you were a pitcher.
So shoulder elbow injuries are extremely common, especially in overhead throwers, javelin, volleyball players. And the two injuries go hand in hand. A lot of times I see players come in with elbow pain, but it's actually coming from shoulder loss of motion. So those two things are critical to keep up on throwing programs, etc., to take care of your body. And like I said, the two things go hand in hand. The elbow is the end result of what's happening through the rest of your body. So there's a lot of things that we can improve when we see players and eval them. And a lot of times that doesn't mean surgery.
One thing young players probably do is maybe overthrow a lot. That probably leads to some of these. Anything else?
Kind of what we touched on already, like not taking care of your shoulder range of motion. There's been a lot of studies that show that the shoulder is related to elbow injuries. And so keeping everything in tune is critical.
We hear a lot about UCL injuries and then Tommy John surgery. Explain what that is.
So Tommy John surgery, there's different ways to do it, but really it's a reconstruction of the most important stabilizer on the inside part of the elbow, which is critical for overhead throwing. You need it. So when players come in and they've lost velocity, they've lost command, that's something that we really evaluate is the ligament on the inside part of the elbow.
This is something that if surgery does have to happen, what does that recovery process look like?
It depends. It depends on the type of injury they have. You're looking at anywhere from probably 8 months to over a year of recovery if you need that. But the majority of players come in, don't need surgery. And so there's a lot of things we can do to get them back to playing without surgical intervention.
And I know as a doctor, it's going to be great to have that relatability with your patients.
Yeah, definitely. I think playing at a reasonably high level gives you the ability to relate to players and family and know what's really important for their development.
All right. Thank you so much. For Healthy Every Day, I'm Amy Sharp.
Watch Healthy Every Day, Tuesday mornings between 6 and 7 a.m. to learn more about healthy living from local experts.